Welcome back to the Practical Pregnancy. I'm Tamara, full-time midwife doing primary care, full scope midwifery in Canada, and so glad that you joined us today. Today, we're going to talk about a topic that really does freak most people out, and rightly so, completely understandably. We're going to talk about bleeding in pregnancy. When you're pregnant, let's face it, nobody wants to see any blood. It is usually something that invokes a lot of fear in people or instills a lot of fear, and it can frankly make you panic in that moment. So we're going to talk about what's normal and what's not normal. So we know that when your baby's first developing in that first trimester of pregnancy, there can be some spotting that happens typically around 6 to 8 weeks that is really, really common to see. And usually if you see it during that time, it's nothing to be worried about. When the placenta is implanting into your uterine lining, there can be something called an implantation bleed that happens. And that's the bleeding that most people see around that 6 to 8 week mark. And again, nothing you did to cause it, nothing you can do to prevent it. And it really usually isn't a sign of anything worrisome. However, if your bleeding is going on for, a week, or you're having bright red bleeding with cramping, blood filling pads or filling the toilet bowl, that would be a reason to call your healthcare provider or go to your local emergency department to seek advice. That said, you can also see spotting or bleeding after you have intercourse, and that can happen anytime through the pregnancy. In pregnancy, your blood volume is going to basically double, which means that all of your body structures that are more vascular, such as your cervix, if they're stimulated, they can bleed more easily. In the obstetrical world, we call it a friable cervix. It's a pretty funny term, but that's what we call it. And it's basically where the cells on the outside of your cervix are sensitive and they slough off. And you can see that in the form of bleeding. So if you have intercourse and right after that, within the next 24 to 48 hours, or immediately after, you have bright red bleeding or old looking blood, don't panic. If it stops on its own and you can relate it back to being intimate with your partner, then it's probably just related to having a friable cervix. That said, again, if your bleeding continues, if blood is running down your legs, if it's extreme bleeding and you're worried, it's always best to reach out to your healthcare provider and just confirm there's nothing further that needs to be done about it. One of the other things that's fairly common is something called a subchorionic hemorrhage. Usually it's seen on a dating ultrasound or a first trimester ultrasound closer to 12 weeks. And it's a little bleed that can happen in your uterus, basically. And if you see that, just know, again, nothing you did to cause it, nothing you can do about it. And it's really, really normal. We see it very commonly. Very, very, very rarely is it related to anything concerning. Usually they just get reabsorbed and you don't see them anymore again. So if you go for an ultrasound in the first trimester and that is mentioned, or you happen to see your report and you see a subchorionic hemorrhage mentioned, don't panic. It's most likely normal and not going to be a problem for the rest of the pregnancy. Last thing to consider with bleeding is that when you are going into labor, there can be some blood. Sometimes it can look like the mid to end of a period. Sometimes it can even be bright red. And that's all normal. You'll hear it called bloody show. And it's really common when people are starting labor or they're in labor as the cervix is starting to shorten and open and change in the anticipation of your baby being born. Again, if you're in labor, you're having contractions, you think this is your time, and you're seeing more than what would be considered normal bloody show, then you should call your healthcare provider right away or present to the local hospital if that's how things work in your area. If you're filling a toilet bowl full of blood, blood is running down your legs, blood is hitting the floor, you're soaking through pads, that would be a reason to get medical attention right away. And that goes to say for after the baby too. After your baby's born, you're going to bleed the most heavily for the first week. Usually bleeding will taper off quite significantly by the 2 week mark. And then between 2 weeks and 6 weeks, you'll have kind of off and on spotting depending on your particular body and your activity level, and all sorts of things can impact that as well. But during that time too, anytime where you feel like it's excessive bleeding, then you should get medical attention right away. So hopefully this information has been helpful to you. If you like our content that we're bringing your way, please remember to smash that like button and subscribe for more content.